To achieve healthcare is to satisfy the needs of patients in the safest and most efficient manner. Unfortunately, healthcare facilities in the United States are unable to achieve an acceptable level of quality healthcare, proven by the amount of medical errors happening daily. As reported by Cohen, medical errors are the third leading cause of death in the United States. As a result of this amount of errors, it is imperative to develop controls to help prevent this shameful number of medical mistakes. Without accepting the fact that there needs to be change, the number of medical errors will only continue to grow. In this presentation, I will discuss the dire need for reducing medical errors, the methods that are out there to detect and prevent them, and the difficulties healthcare workers face when attempting to reduce mistakes. Considering that healthcare workers are human and errors are inevitable, even in the most experienced facilities. However, the relentless amount of preventable errors needs to decrease significantly if quality care is the goal at hand. According to Cruz and Goetz, there are an estimated 44,000 to 98,000 deaths per year as a result of medical errors. This can be calculated as the range of 120 to 268 people dying each day from preventable medical mistakes. A few examples of medical mistakes are carelessness, lack of controls in place, mislabeled medications, improperly stored medications, and illegible medical orders and prescriptions. In a recent video by Cohen, a medical error that was nearly fatal was illustrated as an example of a dosage error. The video depicts two infant patients who were given an adult dose of heparin as a result of medications being put away incorrectly. Negligently, the healthcare worker who performed the IV on the two infants administered an adult dose of heparin within the IV instead of a child's, resulting in an overdose of nearly 1,000 times the amount the patients should have received. Overall, to understand the causes of medical mistakes, healthcare workers need to be constantly aware of their surroundings. This can be correlated with double-checking the medications pulled from the cabinet, ensuring the orders they are doing match the patients they are with, and using effective communication with fellow staff members and physicians. Within the healthcare systems, new programs and strategies are being developed and implemented to reduce medical errors. Designed to improve quality and efficiency of the care delivered to patients, the Computer Physician Order Entry System, CPOE, specializes in reducing medication errors. As of 2015, this system has been defined as meaningful use technology by the Health Information Policy Council. The term meaningful use is used to describe a program that is certified to improve efficiency, patient safety, and quality of care within the electronic health records. Based on the meaningful use status, it can be concluded that more physicians will adopt the use of the CPO system in the near future. According to Cruz and Goetz, the CPO program provides benefits to the quality of healthcare, such as a decrease in adverse drug events, less medication dosage errors, patient allergies, and illegible orders for patient treatment. Physicians who have adopted CPOE have seen a decrease in errors ranging from 17 to 81%. A reduction this significant without the software being expanded to all facilities is prevailing. This increases the quality of care and sets the standards for other facilities to comply with. As reported by Cohen, 30 million prescriptions are dispensed improperly each year in pharmacies across the United States. The tips provided in her video to prevent medication mix-up errors are to double-check that the label and drug match your prescription. In addition to the high startup fees, there were 3 barriers identified as training, efficiency, and process changes, comprising 46% of the reasons that are preventing healthcare providers from adopting CPOE. Fear of change also puts a great burden on the person responsible for the decisions made. According to the LA Times, the medical profession has put its efforts into system-based procedures. This means for every situation, there is a standard protocol to follow to reach the desired outcome. Several of these controls, including checklists before and after operating procedures, have already proven to reduce medical errors. Current medical systems reiterate that the overall issue of medical errors is not related to systems or procedures, but to the acts of healthcare workers themselves. To summarize, The need for reduction of medical errors is great within our healthcare system. Focusing on smaller aspects of quality first will help piece together the puzzle of delivering excellent quality care to patients and their families. These areas include, but are not limited to, service, response time, environment, price, empathy, and dedication. Overall, the need for reducing medical errors boils down to better communication, more attentiveness, and a better check of controls within the departments. While CPOE primarily focuses on medication errors, it is unknown whether there is adequate evidence to test effectiveness on other areas of the medical orders. However, given the fact that healthcare will involve humans for at least the next 50 years, the need for the software intervention to reduce medical errors is an absolute. Thank you for watching.